the most common ocular complication of the rheumatoid arthritis and also episcleritis and the scleritis. The proximal interpharyngeal joint mostly affected in case of the botonier deformity. Okay. In case of Sjogren's syndrome, there is a dryness of the lacrimal gland. That's why there will be no tear. The side effect of the sulfasalazine is very important. You just remember the S side effect. S means the spermia, oligospermia, Stevens-Johnson syndrome, and then the suppression, that is myelosuppression, and also the stain color slant. So all the side effects starts with S, and just add the pneumonitis and the lung fibrosis. So the side effect of the sulfasalazines are very important. And another thing, the sulfasalazine actually exacerbate a disease, that is glucose 6-phosphate dehydrogenase deficiency disease. That's why if any patient is having the glucose 6-phosphate dehydrogenase deficiency disease, and the complications are very important for rheumatoid arthritis. And when you will prepare after passing the Mrcp part 1, when you will prepare for the part 2 exam, I will discuss in elaborate the complication of the rheumatoid arthritis. Now just remember the name of the rheumatoid arthritis complication. Here you can write a mnemonic, that is radio FM. So R for respiratory, okay, R for respiratory, and I for ischemic heart disease, and O for ocular, and F for Felty syndrome, and M, just add the pneumonitis, methotrexate pneumonitis, just add the M. Okay, so this is the radio FM. This is the mnemonic for the rheumatoid arthritis complication. So what are the respiratory complications of the rheumatoid arthritis? Respiratory complication is the most common extra-articular complication for rheumatoid arthritis. What will happen? There will be pulmonary fibrosis, pleural effusion, pulmonary nodule, bronchiolitis obliterans, and methotrexate associated pneumonitis and pleurisy. This pulmonary fibrosis, it is a restrictive lung disorder, but bronchiolitis obliterans, it is an obstructive lung disorder. And what will happen in the ocular complication? That is keratoconjunctivitis sicca, that is the dry conjunctiva, is the most common ocular complication of the rheumatoid arthritis, and also episcleritis and the scleritis are very common complication. Scleritis is a painful inflammation of the sclera, and episcleritis is the painless. The clinical feature mostly same. And the corneal ulceration, keratitis, steroid induced cataract. Steroid causing the cataract in case of rheumatoid arthritis, or also in case of any other chronic disease where steroid is given as a drug, it can cause the cataract. And also chloroquine cause the retinopathy, that is bullseye retinopathy. I have already told it. And also another O is osteoporosis. And ischemic heart disease, rheumatoid arthritis also carry the similar risk of the to type 2 diabetes mellitus and increased risk of the infection. So another I is infection and ischemic heart disease. And D for depression and Felty syndrome, that is the rheumatoid arthritis, splenomegaly, and the low WBC count. But in Felty syndrome you can find the pancytopenia also, but mostly the low WBC count, and also the amyloidosis. So the early extra finding, here you will find the loss of joint space. Okay, loss of joint space. Loss of joint space. Suppose this is a knee. Here there will be the this is the knee picture. This is the knee X-ray. Suppose here there is some space between these joints, knee joints. But in case of rheumatoid arthritis, these joints will be decreased. Okay. These joints will be decreased. and also juxtaarticular osteoporosis and the periarticular erosion and the subluxation. And there will be some deformity. I have already told you, that is the important is the botonier deformity. In the botonier deformity, there will be the proximal interpharyngeal joint mostly affected in case of the botonier deformity. Okay. And this is a swan neck deformity. Swan neck deformity mostly affected the DIP joint and the PIP joint. PIP joint will be hyperextended and DIP joint here will be flexed. Mainly the PIP joint will be hyperextended in case of swan neck, and in case of botonier deformity, this is the opposite of the swan neck. Here will be extension. There will be the flexion of the PIP joint in case of botonier deformity. Okay. And this is the ulnar deviation of the hand. Okay, ulnar deviation of the hand, mainly ulnar deviation of the hand. Okay, ulnar deviation of the hand. Ulnar actually ulnar actually plays in our hand in the medial of our body, medial of the hand, and in the lateral portion of the hand there will be the radio. Okay, so ulnar deviation of the hand will occur in case of rheumatoid arthritis. In your MRCP part 1, you will not get any pictures attached to your question, so don't worry about the pictures. Okay, when you will prepare when we will take the preparation for the MRCP part 2, then I will discuss and show you different kinds of pictures from the rheumatology. So pictures are not important for MRCP part 1. Just remember this criteria: there will be loss of joint space and juxtaarticular osteoporosis, and there are some deformity. Just these are enough for part 1. Here just remember the rheumatoid arthritis pregnancy. Now for rheumatoid arthritis pregnancy, which drugs are safe? Just remember the hydroxychloroquine and the sulfasalazine. Hydroxychloroquine and sulfasalazine, these two drugs are safe. Okay, this line is important from here: sulfasalazine and hydroxychloroquine. And low dose corticosteroids can be given, and NSAIDs also can be given up to 32 weeks. Why? Because due to the risks of the early closure of the ductus. Okay, and if we don't stop the NSAIDs after 32 weeks of any pregnant woman, the baby can develop the patent ductus arteriosus. Just remember the sulfasalazine and the hydroxychloroquine is the safest drug in pregnancy for rheumatoid arthritis. So Sjogren syndrome, it is an autoimmune disorder. It actually affecting the exocrine glands, mostly the lacrimal gland and the parotid gland of our body, and it also develops around 10 years after the initial onset, and it is most common in the females. Mostly common, the 9:1 ratio in case of female to male. Okay, so this is very, very important. Also for exam, this is very, very important. Sjogren syndrome is JS, that is the 60. Why 60? That is 60 times increased risks to develop lymphoid malignancy. Okay, and J actually JAMA, not JAMA, actually gamma, that is hyper gamma globulinemia. Okay, and another is for Zika, that is keratoconjunctivitis Zika. Okay, and add here the Zika. Zika is saliva, mainly the artificial saliva is one of the treatment by pilocarpine. I for infiltration, that is the lymphocytic infiltration. That's why the lymphoid malignancy risk is higher in case of Sjogren syndrome. And also C4, C3, C4 is low. Okay, and here the Schimmer's test is positive. Schimmer's test is positive. Schimmer test is positive mainly normally the more than 10 millimeter of weighting of the filter paper if more than in case more than 5 minutes, but in case of Sjogren syndrome is there is a dryness of the lacrimal gland, that's why there will be no tear. Okay, this is also, just remember the Schimmer test. And another is acidosis, renal tubular acidosis. Okay, and all the antibodies we have already known that are positive, and the management is mainly the artificial saliva, and the pilocarpine may stimulate the saliva production.